Hello, everyone, and welcome to the How to Stop Kidney Stars webinar. My name is Winslow Dixon. I'm here with Michael Castaneda. He is the founder of the Diet Kidney Stone Oxalate channel, and I'm going to let him introduce himself.
Hi, everyone. My name's Michael Castaneda, and I started the YouTube channel Diet Kidney Stone to help people with low oxalate dieting and people that are prone to calcium oxalate kidney stones. Started that in about October of 2018, and going forward, we're going to continue to not only provide information for people that are looking for low oxalate dieting tips, but we're also going to be creating recipes that people on low oxalate dieting can eat.
Well, awesome. Thank you, Michael, for introducing yourself. Let me introduce myself. My name is Winslow. I'm the founder of the Adrenal Alternatives Foundation and also the published author of Chronically Stoned, the Guide to Winning the Battle Against Kidney Stones. So I'm going to share a little bit of my story, and then I'll let Michael share his story. I started having kidney stones at age 15 and was later diagnosed with medullary sponge kidney disease. And this kidney disease causes me to have kidney gravel and kidney stones every day of my life. So I decided that I was not going to let this disease win, and I was not going to let it overtake me. So I went through and I tried to find every resource possible, homeopathic, alternative medicine, modern medicine, and diet to try to get my life back. And I can honestly say that my health is doing better than it has as far as the medullary sponge kidney is concerned, and I am here to just share my story and to help you conquer your battle with kidney stones. So I let Michael explain his story.
Thank you, Winslow. So I basically was diagnosed with calcium oxalate kidney stones a year and a half ago, and I believe 2 years ago, I kind of had an incident where I woke up in the morning and I unfortunately urinated blood, which kind of happens when you're, prone to kidney stones. And I went to the doctors. Unfortunately, they were just like, go ahead, you're fine, you're young, you're healthy, and don't worry about it. And then going 6 months later, it happened again. So then I went through a whole bunch of different tests in and out of doctors, blood tests, and, the urologist. There was a pain, and I'm sure if you're prone to them as well, you've probably been through it as well. And after that, I realized I needed to take this low oxalate diet serious, and there wasn't a lot of resources online. And I was telling Winslow before that I was a journalist, and so it was kind of just a part of me to just do the research and put it all in one place and build a resource for it. And I realized since there wasn't a lot of that out there or books or things like that, I realized I had the skills and the talent to go ahead and put it together to give it to people. So I might as well go ahead and do that. So that's kind of how the channel started, and where it kind of came from. For me, it was a passion for food and a passion and wanting to just give to people the information that I found.
Awesome. Well, we certainly appreciate your research. And so the topic of this educational webinar tonight is how to stop kidney stones. So if you're watching this, I'm sure you know how devastating kidney stones can be. They're severely painful. They can cause all kinds of problems. I have personally had to have emergency surgery to remove them, have kidney stone placement or kidney stent placements, and it's just not a good thing. So the first tip that we really want to discuss is what you eat definitely can affect your kidney stones. Michael has a different form of kidney stones than I do. He has calcium oxalate. I have calcium phosphate. So us both having kidney stones, we had to figure out individually what triggered our stones and what improved and made things worse. So the first tip that I really want to give is that you need to be chronicling everything in your life to try to figure out what's going on, because you can't, if you have all your puzzle pieces on the table, you can't put it together unless you have every piece. You're going to have missing pieces if you're not chronicling things. So food diaries, food journals, things like that are imperative. That's why I published the one that I published, because I was so tired of saying, why did I get this kidney stone? Why did I, get this migraine? When you don't understand what's going on, you can't understand how to improve your life. So food journaling and daily journaling is definitely something that's essential. Michael, did you have any comments on that?
No, absolutely agree. Actually, the most recent video that I made on my channel was 4 tips to help you with low oxalate dieting and how to count your oxalates. And one of the did when I was on this diet, when I started this diet, was I wrote down everything that I ate for 2 weeks straight. And I didn't eliminate my oxalates cold turkey. I actually tried to do that at first, and it just didn't work out. It wasn't until after I sat down and journaled everything that I ate that I was able to adjust my diet. And there was simple things: wake up and I would have a cup of coffee, and then I would eat an egg with wheat toast, and I would just use whatever kind of butter I had in my fridge. After I knew that that was the thing that I normally ate and still do, I was able to adjust. So I changed the wheat toast, which according to the University of Chicago has about 6 milligrams of oxalates. I changed it to a white toast, which has of oxalates. One of the ways to prevent kidney stones is to drink a lot of fluids, drink a lot of water. So before every cup of coffee that I have in the morning, I drink water. After my first cup of coffee, I drink more water. So I journaled everything that I 2 weeks to notice the trends. And then from there, I made adjustments accordingly, because it's almost, for me, I thought it was impossible to eliminate your oxalates, but making minor adjustments was a lot easier, and having that modeled in what I was eating made that process a lot easier. So absolutely, food journaling is, I think, a necessity when it comes to this condition.
Exactly. And I just want to touch on a point that you made about you did things gradually. I know that some of us tend to be all or nothing people. I'm exactly like that. And I was telling Michael before we went live that I went on a juice cleanse to try to lose weight. And I had not met him yet. And so I didn't have this wonderful information about how many oxalates a kiwi had. So I juiced a kiwi, and I had a 4 millimeter kidney stone the next day. Had to have emergency surgery, had to have a stent placement. It was great. So let me just make the point that you can't shock your system by suddenly dropping off things. And, you know, I, as a holistic health practitioner, I put people on, you know, autoimmune protocols and diets and things like that. And it's very difficult for your body to go cold turkey off of sugar, gluten, dairy, all of that all at once. And so you don't want to freak your system out. And so it's okay to implement small changes slowly. Now, I'm definitely not promoting, if you're allergic to shrimp, don't go eat shrimp. I'm not saying that. But I'm saying that if there are changes that your doctor and you feel like would benefit your health, it's okay to do those slowly. You don't have to drop gluten, dairy, and sugar all in 1 week, because you're going to freak your system out. You're going to feel terrible, and then you're going to detox, and then you're never going to want to do it again. And you're going to be hugging the bag of chips at 3 a.m, just crying, going, why me? So trust me, you don't want to go there. Gradual changes are definitely beneficial. And the wonderful thing about Michael's channel is that he has steps and stages that will walk you through how to do that. That will give you those steps to how to manage it. Because as all of us know, life changes are really hard. And especially if you're changing 6 things at once, it's a lot of things for your body to get used to. And they say it takes what, like 60 days to establish a habit and 90 days to break one. You know, I'm not sure the exact statistics. I think I read that. But it takes time to implement healthy changes, and it's okay to give yourself those chances to make those adjustments. Right.
Absolutely. And I think another thing too, which I'm always advocating on my channel, is to get a scale. Just get a kitchen scale. A lot of the, you know, I've read a lot of books on low oxalate dieting, and I've seen a lot of recipes on low oxalate dieting, and it might say something like, one example I've used in the past is half a cup of green beans can have 9 milligrams of oxalates in it. And how do you measure half a cup of green beans? It's not a liquid. So the way to do that is to measure it out. So while I was on this diet, when I first started on this diet, I tried to measure things that way, just like eyeballing it, and was not working out. So a huge benefit to have is that I could actually measure out the oxalates, and I could feel too, instead of just piling on yogurt into a bowl thinking, okay, well, I need to increase my probiotics, and I'm just going to eat all this yogurt here. You know, I was able to weigh it out and know that 4 ounces of yogurt can have 1 milligram of oxalates. Scale as well was something that I found extremely beneficial when I first started on this diet. So if you're prone to calcium oxalate kidney stones and you don't have a scale, I recommend getting one.
Yeah, definitely. Having the right tools is essential to managing any health condition. You know, I did not know about the food scale, so thank you for that. I'll be investing in that. But
Absolutely.
another thing that I just want to make the point of how to conquer this horrible battle with kidney stones is getting a good healthcare team. Is finding a good urologist. It took me almost 10 years to be diagnosed with what actually was wrong with me. And you know, Michael shared with me earlier that when he started getting kidney stones, they gave him the excuse of, oh, you're young, you're fine. That's what happened to me. They're like, oh, kidney stones are a rare occurrence. I'm sure you won't have another one. I was in the ER the very next week with another one, and I became a repeat visitor. And, you know, as a young person, they assume, oh, she wants, you know, opioids, she wants, you know, drugs, whatever. It wasn't that. It was, I had literal kidney stones every day of my life. And it was such an unbelievable story that it took me almost 10 years to be diagnosed. So definitely getting a good urologist, a good nephrologist, somebody that works with you and is willing to understand your case. Don't take no for an answer. I really want to promote patient empowerment because I know that there's a lot of people that are intimidated by doctors. Oh, they're MDs, they know stuff. Well, when you do diagnostics, there are many things that physicians will try to do in these tests, and of course, if they run a specific test and that's not specifically what you have, they go, okay, you don't have that, and then they give up. You need to find a physician that's going to go, this person is having kidney stones, this person is having whatever health problem you're having, let's figure out why. There are many resources that you can do in order to find out what kidney stones that you make. The 24-hour litho-link test was really beneficial to me. Having your kidney stones analyzed. Some people make more than one type of kidney stone, which I find fascinating. Fortunately, I just make calcium phosphate. Well, unfortunately. But you really need to find out what your body's doing. You need to find out what the pH of your urine is. You need to find out what is going on in your specific urinary system. Especially if you have secondary issues such as interstitial cystitis, if you're prone to infections. Sepsis can and will kill a person. And I'm not saying that to scare anybody, but when you have chronic kidney stones, sepsis is a very, very high risk. And so you need to do everything you can to be proactive about your own health. You need to have a good partnership with a physician where if you say, you know what, I think I have a low grade fever, I think I might have a urinary tract infection. That way you can go in and get a urinalysis done and not go into sepsis. I have seen so many people with my disease that have honestly passed away from sepsis because they can be fine, you know, 1 minute and then 24 hours be septic due to an infected kidney stone. That almost happened to me this past April. I had to go in and have a stent placed because my kidney was so nephrotic. It was so swollen, it was about to rupture because of a stone that was lodged. This is your health and this is your life. And so you need to find a nephrologist, a urologist, somebody that understands your specific case. Because like I said, this is your health. And don't let somebody just tell you what they told Michael and I, that, oh, you're just young, it'll pass. No.
You're right. And it's so important. Like, you know your body best. Just real quick, I just want to go back to the kitchen scale. My channel, right, a giveaway. So if you're not subscribed to me yet, jump over to my channel. We'll go ahead and we'll link that down below after this. And there's a possibility you can win a kitchen scale. So just want to plug that real quick. But also, you know your body best. And, you know, for me, you know, I've had people comment on my channel and Instagram me and say like, well, I don't really like to eat. I'm surprised that you can. And, you know, for me, there's certain things that other people can eat that I can't. Try to avoid those things. And that's because like when I eat it, I can feel that my body is different. And you can keep it something as simple as, think about it this way. Some people react differently to different alcohols, right? Same thing with food. You know, drinks and fruits and vegetables and all these things, your body reacts differently to different things that you put inside your body. So always, you know, test out certain things. If you eat something and you feel terrible the next day, find out what that was and just try to eliminate that or lessen the amount that you're eating. Because especially when you're on a low oxalate diet, you're not supposed to eat more than 50 milligrams of oxalates a day. They say you can eat 300 or even more per day, sometimes even up to 500 per day. Depends on, you know, what you're eating. But if you're trying to limit your oxalates, sometimes you might eat something that might just have a few more oxalates than normal. And if that one thing is making you feel terrible, try to find that out and just work on it gradually. That's the biggest thing with this diet, is just working on it gradually and just knowing that if your body doesn't feel good, just there's probably a reason.
Exactly. So, like I said, we wanted to do this video to just empower you that yes, kidney stones are horrific. Yes, they are a horrible experience, but there are things that you can do to benefit your life. I had no hope before I was diagnosed because I had all these kidney stones and I was totally dismissed as a drug seeker by ERs, and I truly was just a young woman in pain. I developed Addison's disease because my medullary sponge kidney was not diagnosed and not treated. So I am here to promote the fact that you don't have to accept that this is just the way that it is. Yes, you might have a disease. Yes, you might have kidney stones. Yes, you might be extra prone to those. But that doesn't mean it has to own your life. Just because you have kidney stones doesn't mean that they have you. So I just want to make the point that, people like Michael and I are here with resources. Like, I have my book that's here. It's available on Amazon and Barnes and Noble. I have sponsorship opportunities. So if you can't afford one, I have no problem, sending one out or sending you the ebook. I do giveaways or whatever, but it's on Amazon and Barnes and Noble under Chronically Stoned by Winslow E. Dixon. That's there. I do dietitian counseling and stuff like that. And Michael has his channel as well. So we just want to empower you that this is not a life sentence. It might suck, and there might be times, we can't prevent everything terrible that happens in life, but you can take control. And Michael has resources and I have resources that can help you figure out these puzzle pieces to help you create a better picture of health, because that's truly what any of us want, is just a quality of life. So if you are battling with kidney stones, I don't want you going away from this depressed or something. There's always hope. My book is filled with alternative treatments, homeopathic therapies, modern medicine. I think sometimes it takes a combination of all of these things and diet and things like that, to manage a disease. So you can't put yourself in a box and say, I've tried everything. Well, this is a big, big world. So I definitely just want to give that hope to you, that you don't have to submit your life to this thing. You have kidney stones, but they don't have you.
Right. That's a really good point. And there's a lot of things that are constantly changing, like through the research that I've found. And just a huge disclaimer for your audience, and my audience definitely knows, but I am definitely not a doctor. I just happen to have been a person that loved food and missed that I couldn't potatoes and eat, French fries and eat spinach dip and things like that. And having been a journalist and a food writer, I was able to, kind of just navigate through and just really enjoy the research that I was doing. And, so I'm definitely not a doctor, but I am somebody that takes this very seriously. And these things are constantly changing, which was one of the main reasons why I wanted to create this channel and create this resource. So I'm not always 100% right. And I don't think anybody ever is, but I definitely, if there's ever new information, I want to know about it. So if there's something that people that, that are listening, have found that we don't know, I would appreciate it if you can find a lot of conflicting information, things from, the University of Chicago, University of, the Harvard University. You have stuff from, San Francisco. I mean, there's just so many different resources, and it's constantly changing, which is also important to note, that if you're just now starting out on this type of diet, if you're just now finding out a little bit about kidney stones, just know that things are constantly changing as more research.
Exactly. And I do like the point, that you said that you have to be individualist about things. And, some people love the potatoes and some people love the spinach dip and all that stuff. And that might not bother, another person, but it might bother you. So you have to be very individualistic with your care. And, I also agree with the disclaimer. I'm not a doctor either, but I think there's a definite difference in, some physician reading about your disease or your condition in a textbook and then you actually physically living with it. I'm not promoting anybody being an armchair doc, but I can tell you that avoiding citric acid helped me more than any medication any doctor ever gave me. I heavily work in patient advocacy regarding pain medication, because this opioid epidemic has taken pain medication away from people who actually need it. I was actually on pain medication for a year. I'm completely off of it now, purely because of my dietary choices. I still have them for the kidney stone attacks and all that, but definitely you can take your life back. And I think that when you have an illness, and when you figured out things that have helped you manage it, people like Michael and I feel like we really have a duty to share that. And, we want to extend that to who's ever watching this. If there's information that has helped you, let us know. We're a community of patients that are advocating for one another. We're advocating for, us to have better days. That's the goal for any of us. We want to have more good days than bad. So, we're a patient advocacy, group that really tries to share with one another. So I just want to extend that, to Michael and I viewers alike, that we want to know. We want you to talk to us. We want you to say, hey, I tried this thing, it didn't work for me. I tried this thing, it did. Let us know. We really want to have that feedback. So I appreciate anybody watching this, and I do appreciate the work that Michael's done. Like I said, he said there's a lot of conflicting research out there, and there is. And I think that it's because everyone is so different. I was telling Michael earlier, with Addison's disease, I actually have to take salt tablets. And so I'm on a high sodium diet, though I have a kidney disease. But my kidney disease is unique because only 10% of MSK patients ever need dialysis. But the reason that our kidney disease is different is because the nephrons didn't fully form. And I'm going to show a picture of a medullary sponge kidney so that viewers can kind of get a picture of that. So the medullary sponge kidney is the one that looks literally like a sponge with holes in it. My nephrons did not fully form properly. So I create the little fish tank gravel every day. But like I mentioned earlier, with diet and things like that, I have gotten my stones down to where they're small gravel, whereas before, they were 4, 6, 8 millimeter, which is very painful. And I still have those, but I have managed it to a point where it doesn't control my life anymore. So we're here to just kind of give those tips to help you take your life back. So Michael, did you have any closing remarks?
I mean, I definitely, we are a very small community. You seem like we're a very vast community, but we also seem like a very small community, which is part of start the channel that I did, because my wife can eat whatever she likes, my family can eat whatever they like, and so through the channel that I've created and through your channel, we're kind of finding each other. So just know that you're not alone. We are out there, and I know that there isn't like a lot of information, or maybe there's too much information, which is what makes this so challenging. But there is a community, and you're not alone. If this is your first time watching, let us know in the comments below, like where you're coming from, and what kind of condition you might have. Just like Winslow said, like she said that she have citrus. Me, on the other hand, I should drink citrus like all the time. So definitely let us kind of dealing with, because we are a small community, we definitely want to be there for each other.
Exactly. I couldn't have said it any better myself. So this has been Winslow Dixon and Michael Castaneda with the How to Stop Kidney Stones webinar. I'm sure we'll be doing collaborations in the future. This has just been kind of a short meet and greet, kind of way out there sporadic video, but I hope that it has given you some tips. His website will be linked below. I'm going to fix that. And my website, I run the Adrenal Alternatives Foundation, which is adrenalalternatives.wordpress.com, and my personal website is winslowedixon.wordpress.com. So if you need anything, like he said, feel free to put it in the comments. Thank you for watching.